Hello, this is Dr. Jeff Wassman from Vital Spine and Pain in Dallas. I am a board-certified interventional pain physician and anesthesiologist. If you're watching this video, a platelet-rich plasma injection, also known as PRP injection, has been recommended to you by our providers to reduce pain, inflammation, and improve healing within a joint, tendon, ligament, around an inflamed nerve, or within the spinal canal. You may also be searching the internet for more information on platelet-rich plasma and came across this video, and if so, welcome. This video will discuss platelet-rich plasma in detail and compare it to steroids that can also be injected to reduce pain and inflammation. We will discuss the experience of a patient who comes to the clinic for typical PRP injection, as well as perioperative instructions we give to most patients. First, let's review what platelets are, what they do, and where they're located. They are cells found within the bloodstream that get deposited at the site of injury. They contain granules, and these molecules get released at the site of injury. These molecules will cause blood vessels to grow into the area to help with tissue healing, and also attract cells such as fibroblasts and mesenchymal stem cells to the area to promote proper tissue healing, remodeling, and strengthening of the tissue. Steroids are also used to reduce pain and inflammation, but unlike platelet-rich plasma, steroids can weaken tissue when injected into the area repeatedly and can even lead to tendon or ligament rupture. When a patient comes to the clinic for a PRP injection, after we obtain consent, myself or one of the other anesthesiologists will draw approximately 50 to 60 milliliters of blood added to an anticoagulant to prevent clotting, since that would ruin the sample. The blood is then taken and processed in a high-speed centrifuge, such as this one here. It'll be spun down for 10 to 15 minutes, which will separate blood into its three main components: blood cells, platelets, and plasma. The platelets will then be isolated along with a little bit of plasma to create platelet-rich plasma. Once this has been completed, the patient will be taken to the procedure room and placed in a comfortable position. We will disinfect the skin site and inject some local anesthetic and place a needle under continuous ultrasound guidance to be sure we inject the exact site of injury. Sometimes we use fluoroscopy to further guide the needle as well. Most patients will only experience perhaps 5 to 10 minutes of discomfort after the procedure, and they can use ice for 15 minutes every 3 to 4 hours after the injection for 1 to 2 days, but usually that's not necessary. When patients are scheduled for the procedure, we ask them to avoid steroids and non-steroidal anti-inflammatories such as ibuprofen and naproxen for 1 week prior to the procedure and for 2 weeks after the procedure. These drugs, steroids and non-steroidal anti-inflammatories, adversely affect platelet function, and that could interfere with results of the procedure. If you have further questions and want to meet one of our providers to find out more, the phone number for Vital Spine and Pain is 469-697-7300. That is 469-697-7300. Thank you and have a blessed day.